I'm here in the background. Hey, I just wanna be I wanna hold you, kiss me, hold you. I love and treat you right. I wanna hold you and I wanna treat you right. Wanna hold you and I wanna treat you right. That is the song that is in the background. You get that? You get that, my people? So, Uncle is here at the background, listening and watching me. So, what's happening with this? Leave something and then you find something inside. Blaze it up, everyone. Today, people are wondering, why is Benjamin the Wise Guy not online? Why? Man, sometimes work have to be done. Work have to be done. You get? Work have to be done. Let's get to. We have to work. We have to work. We have to work. I'm getting some tips over here. Some tips over here, man. I'm getting some tips over here. Let me get some tips over here. This is too much light, man. It's risking my face. So my guys, my everyone, my people who is watching everywhere in the United States, in Africa, in Asia, the land of every person, man. And anyone who is in the background there watching, welcome. Today I couldn't find time to come. Marie, greetings, Doc. Welcome, Marie. Hey, welcome, my sister. Today, but I was on video and I was going when I went to become busy, and I told people today the schedule have changed. I hope everyone watched that video. So how are you doing, my friends? My sister Miss Marie, my daughter Miss Marie, you are so gone long, man. What's happening? We are not talking. Efasi Lipenga, Margaret in Norway, my sister, big up for your message that I got on WhatsApp. Thanks everyone. I can see so many people who are new. If you are new in the house, you know what to do. Ask us on the chats. What's up? What are you doing in here? What are you doing up here? This is Benjamin the Wise Guy. I'm welcoming everyone to this chat. If you are new, please tell us at the chat text. Tell us where you are chilling from, where you are here. We talk about medical issues, medical advice, mental health. I can see Efasi Lipenga is here. So don't leave without saying something if you are a new person, yeah? Greetings to Raben and the chat. At lunch, yes, you are at lunch. Good one. Body have to get something to get energy. Yeah. Thanks for everyone. Today I've come because I was busy. Sometimes getting time becomes a problem. And even my lives, I have to strain and get some time. I have to push some people here and there, so that I can get some time to come live. But all is good, we are here. All is good, we are here. The topic that was continuing was a topic by the name bipolar complication. That bipolar complication that disturbs so many people, and sometimes people say that people are Doctor Ben, are you married? The same question arises again. The same question that ladies ask me every corner. I pass here, I go there, nurses asking me, are you married? Yes, I am. Yeah. The thing that confuses people. But you know, it's good to be asked. When you are asked if you are married, it can be a controversy. Put that ring on. Yes. I will. I'm not a person who loves blinks, but that one I think I will. I have to do it. So everyone, welcome to the chat. I hope you saw the short video that I made, and I was saying that I'm busy a bit, but I'll be online at 8. Miss Marie, please tell people the doctor is married. Yeah. Before we continue now, today is question and answer thing, but we are going to talk about how to manage bipolar complication. How to manage bipolar complication. Miss Marie, I'm joking with him. Miss Marie knows you are joking. Yes, I can see so many new guys is dropping and wondering what is me doing. What is me doing here? Yes, I want to talk about bipolar management. Bipolar management. But if you are a new guy and you are listening to me, look at me, man. Go to that like button, like or double tap your phone, and also come to the chat. When you are a new person and you're just watching, at times it's good to interact. Come to the chat, tell me where you are watching from, tell me, hit the like buttons to come in. Yes, watch as you watch me and listen to me on what I'm going to present. Friends, guys, subscribe and also like. But sometimes people don't like to talk much. I've found people that have followed me for so long, but they get courage. Hello, doctor, I am back. Abihina is here. Abihina, hope you are doing good wherever you are, and everyone is doing good. So I'm saying, there are some people watch me for so long, and then after like a month, they tell you, I've been following you for so long, but I've not been commenting. I've been just watching your videos. That is good. It is good support, and it is greater and greater support. So my guys who are here, my guys who are around, my sister is here, Share Travels. Have you checked Share Travels? Have you checked Share Travels channel? Go check Share Travels channel. She loves driving. She loves driving. Every time, the first days when I was watching Share Travels, every time I log into Share Travels, she's on the wheel driving. Guys, new people, like and subscribe. I can see Gogtug 7744. Hey uncle is busy a bit, but he's in the background. Gogtug, where are you from? Gogtug sounds like an African name from somewhere. Gogtug, welcome to the chat. Gogtug, I hope you have subscribed. Gogtug, I'm from Turkey. Yes, Gogtug is from Turkey. Welcome to the channel. And you are our new friend. Friends come in, we usher them in, we tell them sit here. This is our friend. So interaction is mutual. That is our tea. So feel free to interact with everyone that is in the channel and be our friend Gogtug. Subscribe to this channel and interact with more people also. Margaret in Norway, my sister who is always happy. You see, Margaret in Norway, God created you with bro, remember me, I'm from India. I come to live every day. Thanks Sabina. Margaret in Norway is a person who she's a sister who, even if she's mad, you look at her and you think she's smiling. Always joyful. Gogtug, subscribe and double tap if you are using your phone, you double tap, give us a like. So we are just today, we have a long way to go, a long time to go. It is 8. I want to do management of bipolar, but I'm not just talking randomly because I've been having a very long day. Standing hours, thinking, doing. Standing hours, thinking, sitting, and doing. When you are working with your brain, you have a very long day when you are working with your brain. You see? Now, let's continue to usher in new people. I can see my Efasi Lipenga, my friend, is here. Share Travels has told us she's on lunchtime. Hope she's eating healthy and taking healthy drinks Margaret, I subscribe to your channel. Yes, that is the spirit, man. Margaret, you have a new subscriber. And everyone who is watching, we were talking about we were talking about something called what? Bipolar. Bipolar is a complication, and we said bipolar is a combination of mood and emotions. It is a neurodevelopmental thing. It is not a neurodevelopmental thing. It is a mood complication. So let's see about bipolar management, because yesterday we talked about several things, and before we go to management, there is something that we left. There is something that we left. There is something that we left. I have to make my work step by step. We just don't go what we go. No. We said there are some things that bipolar can weigh up to. Someone having an incident or someone having a condition, and it displays itself as bipolar. Bipolar disorder. Let's see some bipolar plus another condition. You can have bipolar with another condition, and this condition can bring you down. When you have two issues that are striking you at the same time. Water, kaka. Water. I have something here I'm drinking. It is making me feel good. It is making me feel energetic, because today I did not have time to eat. So this is what I'm taking to give me energy. I didn't have time to eat today, and it's 8:30 p.m. right now. So it's giving me energy. Welcome to everyone to the channel who are in the background watching, and everyone who is here. Big up every time. Let's see bipolar and anxiety disorders, because we can see even there are some people who have bipolar and they are misusing drugs, and that is a condition. Bipolar and misuse of drugs is another condition. Oh, it's 10 p.m. in India. Yes, you are ahead of us by how many? 8, 9, 10, by 2 hours. India is ahead of us with 2 hours. You get? Now, we can see you can get bipolar, a person having bipolar with ADHD. So how can you have bipolar with anxiety disorders? Anxious. Some people are always anxious. They always are worried of everything. Perfectionist. Do you remember we talked about a personality disorder? Personality disorder can make a person to be. Can you tell me what causes bipolar? Bipolar, when we started, we said it is a mood disorder and emotional disorder. When we do research on the neurodevelopment and the brain, we find that the brain is okay. But now it is kind of like under investigation and research. And most of the people say that bipolar is carried from the other generation. So it is linked to genetic. The main cause is not known, but what we know is it is interference of neurotransmitters of your brain. Interference of neurotransmitters in your brain that brings you have mood and emotional imbalance. That is bipolar. You get moods and emotional disorders. That is bipolar. But clearly, the research is still going on, and they have never known, because everything when you do to the brain, it becomes when you do everything to the brain is okay. There is no neurodevelopmental problems. The only thing that is causing imbalance is the neurotransmitter, serotonin, dopamine, and epinephrine. My heavy tongue. Now, the bipolar disorders with anxiety disorders. That is the first. I want to finish this before we start another. So, bipolar disorder commonly together with anxiety disorders. This is called comorbidity. Anxiety symptoms may appear before, during, or after some symptom of bipolar. And you remember bipolar, we said it is characterized by mania, hypomania, and both of them, both hypo or hypomania. So this one is, how can I put it now? Bipolar disorder is mental disorder characterized by episodes of hypo, going down. You have bipolar, but you are calm and you are looking depressed. You are looking depressed. You get during or before mood. Oh, uncle is here. Shah Travels was just bigging you up, and I thought maybe you are in the background a bit busy. And often make bipolar disorder severe and difficult to handle. So people who have bipolar plus anxiety disorders, they have problems. Welcome, my friends. Welcome, those new people that are coming. Welcome, welcome, welcome. And ask any medical question. You know, I said yesterday, ask random questions. Hey, I was asked even if I'm single. So let's ask some good medical questions and something that you may want to know about your body and what you may want to know about mental health. Welcome, everyone. Welcome. Types of bipolar. Bipolar 1, bipolar 2, and cyclothymic disorder. Bipolar 1, we said, is hypermania. Mania itself. Bipolar 2 is hypomania. And the other one, which is between hyper and hypo, is called cyclothymic disorder. It is called cyclothymic disorder. Between there, you are a normal person, but no, we see, and people say that electricity in your brain has broken down. Come on, man, don't say that for sick people. Some people call people with bipolar, they are psych. They are psych people. No, we don't do that. These are people who are undergoing a situation, man. And you know, we differentiated bipolar from neurodevelopmental issues. When it comes to neurodevelopmental issues, autism, ADHD, it is a clear thing that the cells at the neural tube, when it is being formed to the brain, they are affected. But in bipolar, that is not the case. This is confusing because everything is okay, but you have carried a very funny thing from your parent. Definition of disorders are always, after disorder refers, anxiety disorder refers to coordination involve fear, worry, nervousness, and autonomic symptom. You start just being worried where you are. You start being worried, anxious. So you imagine you having anxiety disorders, or you know, there are some people who don't know, they are not anxious, and they have never imagined anyone having a problem of being anxious. There is a good way of being anxious, like you have stayed so long from your loved one and you are waiting for that loved one to reach home or to meet after years. You have been waiting so long to start that job that you've been starting. You have been waiting so long to be paid while working. So the first check, you are always anxious to see how it will be. But you see, that is normal because of an incident. But here, a person is always having anxiety issues, even without any incident. You are just sitting and then a person is telling you, hey, I feel something is wrong. Are you feeling something is wrong? Imagine that person plus having bipolar. It wasn't the situation. It wasn't the situation, my friend. So if you have ever met someone with a bipolar complication and having another situation, please always do what? Tell us we see. But because there are some people that you may find they have bipolar. El Marie Smith, hi Dr. Benjamin. El Marie, how is the going where you are? You have not talked for some time. I hope everything is okay and you are healthy. I always want people to feel healthy, to walk and talk and smile. Walk, talk, and smile. Walking, talking, and smiling like Barry walking exercise. You know, it gives you life, man. It gives you energy. It makes your mental health bloom like a green growing tree that has nutrients. You see? So let's just walk, just how Barry exercise tells us. Let's walk, guys. Let's walk, my friends. As we walk, let's talk. Let's interact. That is Barry walking exercise. Now, welcome, El Marie. We are talking about bipolar in association with other conditions. But you know, anxiety disorders, there are some going is good as far. Going is good. Yes, that's what I want to hear. As per the definition of anxiety, we have anxious categorization, specific phobia, post-traumatic stress disorder, obsessive compulsive disorder, social anxiety disorder, panic disorder, and general anxious. You are always anxious. You wherever you are feeling something is wrong or something is about to happen. Generalized is a chronic mental condition characterized by persistent, excessive worry about various aspects of life. It significantly affects functioning and well-being, because if you are always anxious, what will happen? You will lose track to think about the most important things. So guys, let's stop being generalized anxious. Let's stop being anxious. Let's live. And hello everyone, greetings to all. There is panic disorder. Panicking. Are you panicking? Why are you panicking? In Kenya we say kushtuka. Mbona unashtuka kila saa? You are panicking, my friend. Have you ever met someone who is panicking every time? Or are you that kind of panicking every time? Why are you panicking? A Tanzanian will tell you, are you panicking? Panic is a type of anxiety disorder characterized by recurrent unexpected attacks. There was a day we had friends. We used to go to it's called a youth center. So you know, youth centers, we interact. I was young that time, around 23 years of age. So we used to interact, sing, dance, we do things, we play computer games. It was a youth center, and I was a leader in that youth center. So while we were seated there outside under a tree, after playing games, and we want to sing, then you see a lady falling down and starts to create a scene like she's convulsing. But it's not convulsions, you get? It's not convulsions. So what I did is carry this lady, put this lady on a place that is open with air. And then when you ask a lady, I asked that lady, what is happening? Why are you, you feel like you want to convulse, but it's not convulsion? She told me she felt like something was about to hit her. And we know we were seated as friends. So that is kind of panic attack. You panic until you feel that something can give you, can hit you. Okwemba, my namesake. Okwemba, are you in Vihiga today? Are you in Vihiga today? You told me you are traveling. And then we have obsessive compulsive disorders. You know what I'm saying? These conditions that I'm naming, like generalized anxiety disorder, panic disorder, social anxiety disorders. These are types of things that are associated with people. A person who has bipolar but has this one. So you can be obsessed with something. You can be obsessed with something. Yes, sister. Is it at night where you are, my sister, or what time is it? Or you are preparing supper? So you can be obsessed with your boyfriend. You can be obsessed with your husband. You can be obsessed with your you're a woman, and it's not good. Sometimes obsessions can kill dreams. Oh, Okwemba has traveled to Vihiga. So obsessions can kill dreams. And when they kill dreams, problems happen. Problems happen. So obsessive compulsive disorder is a chronic mental issue, marked by intrusive, unwanted thoughts and repetitive behaviors or mental rituals. Hey, imagine. This pattern can cause distress and interfere with work, school, or relationship. Because if you are obsessed with something and you are in a relationship, what will happen? It may interfere with the calmness of whatever that you are undergoing. Interfere. So it is not good to be obsessed with some things. But what we are talking about is it is a problem you don't want, but you have it, plus bipolar itself. So you have to be helped. But sometimes some people problems when it comes to when they want to be helped. These people knows everything. A person who is bipolar knows everything, and before this person accepts to be treated, hey. Ever try to tell a bipolar person who has not accepted that she or he is bipolar? My friend, you will have it rough. You will have it rough. Gabriel, welcome, Gabriel. Welcome. I see you, big man. Gabriel is big man in the house. Those people that are in the background, please tell us as you watch where you are watching us from and where you are feeling Benjamin the wise guy from me, Dr. Den. But if you have any medical question or a topic of interest that you feel you want people to help you reason, that topic of interest that you feel you want to help people, boss, Sirewana is here in the background listening. If you have a topic that you want to be helped with someone, with some people here, please bring it up. Bring that topic down. Let's help you reason it. Let's help you reason the topic. Yes? Kate, hello everyone. Kate. Hello everyone. Kate, welcome to the platform. Now today we are talking about issues that are related to bipolar, but they share the other condition, like being anxious. And I've said that anxiety has several issues. Common anxiety disorders associated with bipolar are the ones that I'm naming. Nana, who is Nail Kerimo. Where are you from? Nail Kerimo 4950. I'm from Africa, the land we love. Africa, Kenya is my land. Nana Kerivo. I think you are a new person here. Please interact with some people. Like the channel and hit subscribe, my friend. Nail Kerimo. Subscribe. Feel the vibe. I love Kenya. Kenyans are good people, very aggressive, hardworking, and they are go-getters, and they interact and they are very social. So, Neil Kerimo, as you love Kenya, love the channel by a subscription. Love the channel by a subscription. There is something that is called post-traumatic stress disorder. Anyone who knows about PTSD? Anyone who is listening and knows about PTSD, please? Anyone? PTSD, post-traumatic stress disorder. Something happens to you and it traumatizes you continuously, but because when you remember about it, you start having stress after trauma. It can be an accident, a disease, a bad relationship, some things like that. PTSD, post-traumatic stress disorder. These ones can be compared to people that have bipolar, and they can be associated with bipolar disorders. So if you meet a person who has a post-traumatic stress disorder, You should always help this person to move on. They need counseling every time so that you can remove the part of PTSD and remain with bipolar part. Yeah? You remain with the bipolar part, you remove the other part of PTSD. You see? So, my people, we are talking about conditions that can be associated with bipolar disorder and another condition. We have said about anxiety. What is the relationship between bipolar and anxiety? Anxiety disorders are very common in bipolar, very common. Yeah? Because serotonin, dopamine, and neuroperipherin, including GABA system, those are the ones you call in Kenya stima in the brain, neurotransmitters. They take electrons, they are neurotransmitters, some chemicals. They are involved and they are imbalanced. And you see, in anxiety disorder, the same happens. In anxiety disorders, it is the neurotransmitters that are having a problem. You get? So, guys, there are some things that we need to know about what we did. What we did is neurodevelopmental disorders and bipolar. Let me not go down so much into anxiety disorders because that one can be helped. But you see, neurodevelopmental disorders plus bipolar. Let me take an example of ADHD. Do you know ADHD? Anyone who knows ADHD? We have really talked about ADHD for long. Welcome, Bosire, Neil Kerimov. Neil Kerimov. Sometimes when you go through names of YouTube, sometimes you feel even calling them is hard. Like Neil Kerimov is from India. I think he's from India, but saying that name is hard. And you know, you can call someone a name that that person does not want, and it can bring you problems. So I usually like people to tell me how they are called, so that I call their name as it is. So ADHD is attention deficit hyperactive disorder. ADHD, characterized by cyclothymic and characterized by inattention, hyperactive, and impulsivity. Inattention, you don't have attention, and then the other one is hyperactivity and impulsivity. Hey, you do things without impulse. Okwemba is a calm person. Have you ever met someone with hyper inactivity and he has ADHD? You know, people think that attention deficit hyperactive disorder is only when you have things that are disturbing you and you are doing things without, doing things without thinking. But there are some people who are very calm, people that are calm, but they have ADHD. So what is the relationship between bipolar disorder and ADHD? What is the relationship between these two, bipolar disorder and ADHD? ADHD patients have increased risk of developing bipolar disorder later. Bipolar patients often shows childhood ADHD symptoms, mood swings, emotional problems, but when you grow up, you start having bipolar itself. So the children that are aggressive, they cry, they take things, they throw away when they are little. ADHD most affects children. Yes, even adults, because it is neurodevelopment. You know, when a person notices that, because it is neurodevelopment, it's physical in the brain. When a person notices this person has a problem, when they grow up, they start learning to live with it. But a child cannot. And you see, when it is associated with bipolar, this is where you see children, when they are crying, they are throwing things around, because the neurotransmitters are not Yes, most of boys, true, most of boys, they are not stable when it comes to neurotransmitters. Hmm? Bipolar patients often show childhood ADHD, but when you grow up, it turns out to be bipolar, but with association with ADHD. Comorbidities leads to severe psychiatric impairment. Comorbidities, exposure to some things that can irritate and make things worse. Exposure to some things that can irritate and make things worse can make it so worse. You get? It is very risky at times when it comes to comorbidities. It is very risky because you are taking alcohol and you are bipolar plus ADHD. You are living in a stressful environment and you are bipolar association with ADHD. It can make things so worse. It can make things so worse. But you have seen people that have bipolar and ADHD combined. Some of them have committed suicide. Some of them have killed. Some people have beaten. They have made people paralyzed. And those are the situations that we are avoiding when it comes to these problems. We are avoiding some bad situations to happen. We are avoiding incidences that can injure a person. We are avoiding incidences that can injure a person. So, my friends, you see, ADHD and bipolar is not a good thing. It's a bad combination. Let me take a sip, especially when it comes to children. Because if you leave your child with having ADHD and bipolar situations with other children, what do you expect to happen? What do you expect to happen? This child can injure other children that are vulnerable because they live a normal life, they play well, but you have a child that is having both. It can bring problems. And why do they occur together? Because both of them, they are sharing imbalance in neurotransmitters like dopamine, norepinephrine, and serotonin. Both of them. Neurobiological abnormalities. Always we talked about when it comes to neurobiological, when we were talking about the formation of the brain, ectoderm cells forming the neural tubes and going on and on, the prefrontal cortex becomes a problem. Dopamine, where it comes from the prefrontal cortex, it is not released as normal. Limbic system has a problem because when your brain was being formed, ectoderm cells at the blastocyst that is being implanted in the uterus had a problem. Emotional impulse regulation becomes a big problem because the limbic system and the prefrontal cortex are the ones that are making you control your emotions. So when you are sad, when you are mad, and you look at someone and you see this person, I can hit this person, serotonin comes, you remove something called serotonin neurotransmitter, and it brings you down, you start feeling the urge of feeling nice. You see that? That is how they balance. Dopamine, you get, you remove something that is called dopamine and you start feeling pleasure. When you are bored eating alone at the roadside and a beautiful girl passes, a man, you look at the beautiful girl and you feel like telling that girl, please join me. It is because dopamine has been released from the prefrontal cortex, pleasure hormone. So when you have inactivity or imbalances of both, they can bring ADHD or bipolar situations because both of them have a problem with the neurotransmitters, the dopamine and serotonin and norepinephrine, and the other one, which is the last, which is GABA. So they share. So someone can be bipolar and this person still has ADHD, and when it has a burst out, this one is always severe. Which things are shared between these two? See, there are some things that are shared between these two, like distractibility, hyperactivity, those things, hyperactivity, talkativeness, you talk a lot, impulsivity, doing things without reasoning. You start reasoning after you have done. You start doing things after you have done. So if you did the wrong thing, have you ever met someone that you are talking, and something that was a secret, this person has already said it, and then the person finds out that, oh, it was a secret, I was not to talk about it, then she does impulsivity. You talk a lot until you start pouring out secrets. Sharing. These are shared symptoms between ADHD and bipolar. Shared symptoms between ADHD and bipolar. You see? Very complicated. Poor concentration. A person with ADHD concentrating is a problem. Wants to do this before finishing that one is talking to this one at work. Before he finishes a statement, he has started another conversation with someone else. This is what we call ADHD. But you see, it's coming with some situations of bipolar disorders. And then people with bipolar disorders, sleep is a problem. Sleep is real problem with people with bipolar situation. They are risk takers and risk behaviors. The reckless behaviors that people do. Drinking without thinking, shopping without thinking where we'll get money tomorrow. Having every partner you have, as long as you feel that partner is handsome or beautiful, those are reckless behaviors that people with ADHD, bipolar disorders undergo. People with bipolar disorders undergo. Now, but let's get this difference, because they can share, but there are the differences between people like, yes, Coffee Cakes, my real friend here. Coffee Cakes, how is your coffee right now? Do you have your mug right now, coffee? A mug of coffee. Is it there holding? Today I'm taking Coffee Cakes. I'm taking apple juice because I've not eaten from morning. So I'm taking in something that has sugar to give me energy to talk and talk. No, I'm drinking water. That is nice. Water is a good thing. So we are talking about differences again, because conditions can be conditions. They can be shared and they cannot be shared. So bipolar disorder and ADHD at onset, it's adolescent. ADHD, bipolar starts mostly at adolescent stage, when someone has started realizing, I am a woman. Oh, Savior Man, can you save me here? Come on, Savior Man. We haven't talked for some time, Savior Man. Hope job is okay and you are doing good, Savior Man. We have my friend, the Coffee Cakes, my sister Margaret in Norway, Elmarie Smith, Bosire one from Nairobi, Savior Man. But as always, Efasi is here. Always a shy lady, but we love her the way she is. Our brother Gabriel Mwau and our CEO boss, always in the house. Always in the house. Now, look at this. ADHD starts at childhood. Bipolar at that age, when someone has started realizing that I'm a man, you are a woman. I have decisions to make and I can be aggressive if I want. Yeah? That is bipolar and ADHD at childhood, especially boys. And Marie Smith has told us, especially boys. And boys in the house, say hi. Any boy in the house, or we are always men in the house? We are always men in the house. Yes, men in the house. Cause episodic and chronic. Bipolar can have an episode, but ADHD is a chronic one. It comes anytime. Bipolar, you can find sometimes it's coming. So mostly when people had cyclothymic, cyclothymic, you see, it can have a problem. Mood changes. Would that be due to the testosterone? Oh no. Testosterone is just a hormone that defines a man. It gives you the muscles, it gives you the voice. Coffee cakes, you hear how I'm talking? I'm talking like a man. If a lady listens to me talking like a man, asking me, are you married? Because she knows I'm talking like a man. Gives me the energy to fertilize. That is testosterone. It gives you the manhood, but it doesn't give you complications. The other one, if testosterone is high, you remember we talk about the other cancers like the prostate cancer. We talked about them. Jatin Choncha. Jatin is here, my friend. You remember our student Jatin who was taking the girlfriend to take coffee, and I advised Jatin, how is the going? Hope your school is good. Undergoing medical classes as needed. When you have a problem, you come here, you watch my videos, I explain to you how you can pass your exams. Jatin, nice sir, good. Now, episodes of mania. In bipolar, we have mania, but in ADHD, we don't have mania. ADHD has no overreactiveness and being, wild. No. But bipolar, someone can be wild. Someone can talk and start pushing people away and shout. Bipolar. That is called mania. Grandiosity. Hey, grandiosity, my friend. Do you remember grandiosity? Common in mania. Grandiosity. And you remember yesterday, as I said, some people would say, I am the greatest of all. I have spoken to God, and God has told me that I am the one to pass the anointing to you so that you can live a good life. Without respecting me, you will not have a good life. You will get a bad life and you will die. That is a person who's grandiose talking. Sir, I'm preparing for something. Oh, Jatin, what are you preparing for? Supper before you go to the library. So, common in mania, grandiosity, but in ADHD, mostly in ADHD, you will not get the grandiosity. That one you will not get the grandiosity. And what my words, some people, I'm repeating, when you see some people are talking things that are contra-social, you understand. Things that are contra-social are things that are beyond the world. Things that are beyond the normal things that we know. Start knowing that that person is grandiose. You are preparing for something. No, I'm not preparing for something. I'm in the office talking to my people and explaining to them some things. Jatin. So you understand that, my friends? Grandiose. The feeling of grandiosity. Onik, my friend, where did you go? Yesterday I didn't see you, but hope you are okay where you are, Onik. Hope you are doing fine. Reduced need to sleep. Reduced need to sleep. You are always having reduced sleep. Bipolar. But when it comes to ADHD, you are okay. Psychosis. If you see someone is bipolar, this person may get psychosis at a time if not treated well. But ADHD is rare. You get? ADHD is rare. We talked about the symptoms of ADHD. Guys, have you ever met someone who has bipolar and attention deficit disorder? Attention deficit disorder. Tell me if you have ever met someone who has this. But we have another one. We have another one which is bipolar plus obsessive compulsive disorder. Have you ever been obsessed of someone, or let me ask, have you ever got someone who is obsessed to you, or have you ever met someone who is obsessed to buying watches, or have you ever met someone who is, this person is rich, just obsessed with cars, a particular type of cars. This person has money and he is just buying Ferraris. In the parking, you can get more than 15 Ferraris that are not doing anything. You go to the shoe wardrobe of a person, you find that this person has a multiple pair of shoes. He cannot even remember when he wore a certain type of shoes. Obsessive compulsive disorder with bipolar. Obsession. And obsessions are, obsession sometimes can be tragic. Obsessions at times can be tragic. Someone can be obsessed with someone until this person decides to do something bad to the person. Poison, because you are not listening to me. I'm following you. How many Ferraris do you have, Dr. Ben Lol? I'm just joking. I have not owned a Ferrari. Hope one day I'll own a Ferrari. I have a BMW. I have a BMW. But Ferrari, no, I don't own a Ferrari. Maybe when those cars like Ferraris, coffee cakes, sometimes I feel they are when you have enough money and you want to buy toys. Now you buy a Ferrari, it's like a toy. When you want, it's not a car that you can go so far with, just for around town and going back home, feeling the sweetness of driving a good car. It's a toy. My guys, people out here, they live good. You have cars to take you away, long distance, but you have some cars to make you feel, I'm driving, I'm that standard driving. So you go to the town, but people like doctors, like us, we have cars to take me from point A to B when it is necessary and when I need so fast. Cars that only are for transportation, and sometimes you don't even enjoy the cars. But it was an example that, yes, and yet they charge us 28K for a wheelchair we need. Imagine, they charge you for 28K. Some people here I don't know if it is being blessed or, let me ask and help me think. I don't want to talk something that is bad, but help me think. If you are having 12 Ferraris in your parking and you are driving 2 V8s, BMW and one Cayenne, Porsche Cayenne, but next to you, on my way to night shift, family, I will keep the live stream running. So thanks, Doc Ben, by everyone. It's okay. FRC, thanks a lot. But you have your neighbor who works as a laborer, goes to work with a bicycle, strains to pay fees for the children, and always struggling to put food on the table. So for this person who has a Ferrari and everything that this person needs, is that a blessing? Or just right next to you is a person who is struggling to put food on
on the table, but you have 12 Ferraris plus a BMW V8 or 7 and a Porsche Cayenne. This is coffee cakes. Onik from Armenia. Imagine that. Yes? Onik from Armenia. I want you to help me reason with that. Yes. Okay. I want Onik and everyone who is on the platform to help me reason with that. Is that being blessed, or is that being how can I say? Because when you are enjoying taking that car, leaving millions of monies in the parking, passing someone who is a laborer, Hubs 5851, hi, how is the going, Hubs? And that person telling you that my child has no school fees, and you go to work, you come back, you are okay, everything is fine for you, while someone is sleeping angry. Is that being blessed? Guys, let me ask. Yeah, I know in the world you cannot help everyone. In the world you cannot help everyone. But it is something, it's a question that has just come up. Your next neighbor is struggling to put food on the table. You are struggling to pay fee. And in the parking, you have 12 Ferraris and some 2 big machines. That neighbor cannot come to your house because the gate has 2 soldiers and you have 2 gates so that they can come in. So when you come, the neighbor comes to the gate, is asked, where are you going to? I'm sorry, if you don't have an appointment, you can't be there. But you've been growing with this person since childhood, and you always pass there seeing the children and seeing how they are doing since childhood. Is that a blessing? Sometimes when you have more than enough, it's not yours. Will mean later for you, someone or you. It's a form. Yes. Coffee cakes, you are saying true. Sometimes when you have more than enough, it's not yours. It's not yours. That one, if you are listening to me, that question, just tell me for real. Is that a blessing, or there is a problem that you have that you are not seeing? Sometimes I feel, sometimes I usually feel, me personally, I usually feel it's not a blessing. You hate them, and your neighbor is having problems, so you are there to help. Person, I'm from Krishna Bardhan. Welcome, Krishna. Thanks for coming in. Here we are talking about issues of medical health, and so tell us about yourself, Krishna. Interact with the people on the chat. Hope you have subscribed. That is Krishna Bardhan. Welcome, Krishna. So think about it. We are talking about obsessive, and it is night here. Yes, even here it is night. I know, Krishna, where you are, it is around 10. It is around 10:20 or 10:30. Here it is around 9 or 8 p.m. So, my friends, those are those questions that they just come and we asked. Benjamin, where are you? I'm in Kenya. I'm in Kenya, Nairobi. I am in Kenya, Nairobi. And you, where are you, Habs? Where are you from? Krishna, you know, in India. Oh, I'm in Jamaica. I'm coming, Habs. I'm visiting Jamaica next year with Jamaican uncle. So, hope one day we will meet. People call me a Jamaican that was lost in Africa and came to Kenya. Let me go visit Jamaica and see if it is true. Now, Krishna, you know, your name is suggestive of the eighth avatar of Vishnu, the supreme god of Hindus. Krishna was a god. Oh God, if I'm here. Okay, great. If I'm here. Oh, okay, we will see. So Krishna, your name is a name of a god. So you should be having a good heart and a supportive heart. You get? So we were talking about bipolar and something came up. So we get confused on that thing. But let's continue on what is your age, Habs? Ladies never say age. Even men nowadays, they don't say even men nowadays never say age. Now let's talk about bipolar and schizophrenia. Krishna is an open person. When you see a person asking questions directly, that is no. Before we go to bipolar and schizophrenia, let's talk about bipolar and something called eating disorders. Eating disorders. Have you ever met someone who has eating disorders? Bipolar and eating disorders. Won't disclose on air, sorry. If I had known you, I would. Okay, I said that one will not come out. You see? So, my friends, have you ever met someone with bipolar and eating disorders? A person who eats without control. And you know it's normal because eating is something that makes you have the energy to do things. Bipolar is associated with mania. Inactivity, hyperactivity. You get? So if these things are confused and are taken care of, all of them, what do you think will happen? You will need to eat a lot so that you can maintain the energy that you have. Mood, impulses, self-image. You get? And self-image. So these are things that are combined, and when they are combined, you start having problems with eating. Because eating is controlled by the neurotransmitters. Mood, impulses, stress, self-image, shared neurotransmitters abnormalities. Both disorders involve disturbances in serotonin. Krishna, Habs is telling me to listen. Krishna, Hab is telling me to tell you you listen to her, please. She is a lady, and ladies are not asked some questions directly. They are asked politely. Benjamin, I'm at work, so it's in and out. No worries, El Maria, I understand. You know, even today, I could not come live at my normal time because I was so tight and I had not scheduled any. So I understand. So Krishna, you be coming here, Krishna. I see you like Hubs. Be coming here, you interact. Let Hubs get to know you. And then you will, something will come out and everything will be okay. Keep coming here, Krishna. This is a good place that you'll meet good people like Hubs. Impulsivity, binge eating. Benjamin, okay. Hubs, I like you. Hubs, where? Hubs, listen. Someone likes you, honey. No matter what, you say I know. Habs, listen now. Someone loves you, Habs. Hey, more than anything. I like this. I like this. Krishna, keep pushing. Krishna, keep pushing. Keep pushing. Yes, it is spicing up. Have you see when someone I've just talked about the pleasure hormone dopamine, and it is coming out right. People are getting dopaminergic effect from the prefrontal cortex. Like Krishna has already gotten the dopaminergic effect. Let me ask Krishna, how old are you? Krishna, how old are you? Guys, check out the chat. Something is burning. I'm burning up. I'm burning up. Hey, my life on fire. I'm burning. Yes. Now, we were on bipolar. Oh, Krishna, you are only 20 years. You still have a long way to go, my friend. You still have a long way to go. Do you have a girlfriend? If you have a girlfriend, okay, I won't mention that. Let me continue. Krishna, share this chat and like. Krishna, have you liked the video? And have you double tapped your screen and subscribed? Subscribe so that as you continue to watch the chat, you will be meeting hubs and spice, and dopaminergic effect will continue from the prefrontal cortex of your brain. You will start having some good. Guys, go to the chat. Something is burning. Yeah, check guys the chat. People are having good time there. Now, impulsivity when it comes to bipolar plus you have a girlfriend. Okay, nice. At 20 years. Hey, nowadays people, all generations are great. You see, Krishna has a girlfriend at 20 years. My friend, hey, at 20, I could not reason anything about having a girlfriend. 20 years. Hey, my parents, where? Now, bipolar with problems of eating disorders, binge eating, purge, substance abuse, risky behavior taking. You are having bipolar and then you are taking something like marijuana. You are taking something like marijuana. What will happen? You will have a problem with eating. You will eat so much. Now, why do we have bipolar with issues with eating? Why they coexist? Why do they coexist? Herbs, you have herbs. Why they coexist? You know, my platform is a medical platform, my friends. So when I see some things and I'm talking about I'm talking about mental health issues, you see, and those mental health issues are coming out right now. Now, Habs, you know, we talk about so many things, and this is when we talk about mental health issues, problems, Habs, you see them right, left, and center. So when you see some mental issues right, left, and center, you laugh and you move on. Habs 58, 51. You see, that is I use normal and things that we see to enlighten people. So an example is Krishna, 20 years old, still a young child. I call him a young child or a young boy that is hitting on herbs online. mental health issues, but Krishna has a girlfriend. Krishna has a girlfriend. So what do? We don't kick Krishna out. We advise Krishna on matters concerning relationships and how to handle relationships. And of course, even matters concerning how courtship issues are, for those that know. Yes. In my channel, I don't kick people out. I tell them the truth, so that they can go and synthesize. Now, we were talking about why they coexist, why eating disorders with bipolar disorders, why they coexist. You see, they are, Jatin is back. They are related to mood, impulses, stress, and self-image. And then you will have neurotransmitters, the normal dopamine and norepinephrine. And then you will have impulsivity. Impulse contributes to binge eating, purging, substance abuse, risky-taking behaviors, especially during manic and hypomanic disorders. Krishna wants to cheat on the girlfriend. Okay, and psychosocial factors like low esteem, trauma, perfectionism, and anxiety. So these are things that makes people to suffer. Obsession. And we are seeing some kind of obsession is just wants to create, it wants to be built just right now. You see, my friend here is telling someone to tell me you love me. That is not the way, man. Courtship does not come like that. You tell someone, I like you. If you don't like me right now, I'm going. Man, where did you go wrong? So eating disorders, we have talked about psychological factors, types of eating disorders associated with bipolar. You know, we have eating disorders that people with bipolar have. Types of eating disorders that are associated with bipolar. Let's see, what are the types of eating disorders that are associated with bipolar that you know? There is a very common term that we know, it's called nervosa anorexia nervosa, extreme restriction of food intake, intense fear of gaining weight. Ladies who are listening, this is not bulimia, coffee cakes. This is called anorexia nervosa. Anytime you hear anorexia, you know it is slimming. Ladies, are we together here? Are we together? Extreme restrictions of food. Sir, how this topic is very long. This is continuing since night. Yes, it is long, but you know, when you want you have any question, you ask. I'm talking about yesterday we were talking about extra manifestation. Today we are talking about things that are other conditions that are related to, that come out with bipolar. Some conditions that come out with bipolar. So ladies, some people that are bipolar and you see them, they don't want to gain weight because they are obsessed with being a model. Distorted body image, severe weight loss, intense fear of gaining weight. The ladies, man, some people go and do liposuction. Liposuction, my friend. Some people go and do this rib removal because you want to look like someone else. Liposuction, herbs and spice. Herbs, sorry. Liposuction is the removal of fat, excessive fats from around where you want by a machine. It sucks the fats. It's a surgical process. And nowadays I see people doing a lot of BBL. Anorexia nervosa, losing weight. That is not good, but you see, if you are in the people do them and they enjoy doing them. They enjoy doing what they are doing. So what can we do? When people enjoy doing what they do, you cannot tell them to stop. Patients may become dangerously underweight. Now they take Ozempia. Yes, Ozempia is let me talk about it because it has come. It is a type of hypoglycemic agent. People with diabetes can take it. People with diabetic can take it. It is called semaglutide. Semaglutide is a drug that helps people with diabetes. You get? What is this coming? Now my network has started to bring some issues. Semaglutide is something that helps people with diabetes. So what it does is it stops the absorption of glucose when your blood is going through your kidneys. And if you don't absorb glucose every time you go to the long call, or when you go to urinate, you are passing on sugars. You know, you will not have energy. So you will not have glucose to create energy and other things like excessive glucagon. So you continuously, it's like you are eating and the energy you are eating is urinated. You see? So when that is happening, it is causing toxins to your kidney, because you will have infections every time. And you will start feeling nausea, vomiting, diarrhea, stomach pain, and constipation. You get? So some things, when you take them, please talk to your doctor so nice, so that you can know what to do. I've said Ozempia is semaglutide. It is a diabetic. Ozempia is only intended and approved for people with type 2 diabetes only. But you have noticed that when I'm taking this drug, the next thing I'm feeling is I start to cut weight. So you are eating while you are urinating what you have eaten. Instead, that food to go to your body to be converted into glycogen. So people that want to cut weight and you want to use semaglutide, the Ozempia, you listen to me, please. Listen to doctor here. Listen to Benjamin, the wise guy. So if your kidney does that for so long and it is getting, some celeb take Ozempic to lose weight. Yes, they are doing wrong, Jatin. They are doing wrong thing to do that. So if you are planning to do that, stop. Go to your doctor. Let your doctor advise you the right way to lose weight. And you know, sometimes your body, even if it is big, maybe it is genetic, and the calorie intake that your body needs and your brain is kept on your big body, so that you cannot be always feeling dizzy. And you get me right, my people? So people that are like here, they are doing a wrong thing. And you have seen some side effects. You have seen some side effects. Let me talk about it because it has come up and people are using it out there. You see, if you have a question on it, please ask. Or if something you want to add, please ask. These things that people do are not good things. They are destroying themselves. The side effect of Ozempia is nausea, vomiting, diarrhea, constipation, injection site, and all those. blood sugar levels going down, you are normal and you are having Ozempic and insulin is coming out, you will start having kidney issues, usually dehydration due to vomiting. And you know, when you are vomiting, mostly you lose electrolytes. You have something that is called electrolyte imbalance. Having electrolyte imbalance, my friend, is a big problem. And it may bring something like thyroid tumors. Thyroid tumors carries a warning about possible tumors in animal study. So you, as you want to slim and look like some celebrity somewhere who was born with that slim lady and is okay, you start listening to yourself. You start listening to yourself. I'm just giving you notes. Don't feel bad if you are using it. People have done liposuction out here. No, those ones, their tin are not good. You will start having sepsis and transfer rejections. You will start smelling. You will start having a body that has scars. I think people should just accept their own body, and if it is a natural way of losing weight, you will just go to the gym. We go to the gym and we feel that we are gymming and feeling nice. Bipolar plus post-traumatic stress disorder. We have talked about it. Bipolar plus, let me feel at least at ease. Bipolar plus diabetes mellitus. You see, we have so many things that we have to talk about. They inject Botox from migraines here. They inject Botox for migraines. Hey, woy. People are undergoing. Life with the Serens is here. Life with the Serens, welcome. I think it's the first. How are you? I'm fine. Life with the Serens. I'm really fine. We were talking about this thing that called bipolar with some situations, and then another topic has just come in, and it's an important topic. This topic is about Ozempic, losing weight, Botox, liposuction. So people questions. You see, yes, Dr. Ben, my neuro does it. Not for me though. Hey, Botox is a purified form of botulinum toxin used for cosmetic and medical purposes. It is temporarily relaxes muscles by blocking nerve signals. For me, I will not advise it, sir. There is winter or summer in Kenya. Here it is winter. I will not advise it because anything that stops neurotransmitters to work. Yes, that is the Oz. Yeah. Life with the Seren, that is the Oz. It's a bad thing. You can get thyroid tumors, you see. The Ozempic can paralyze your intestines. Yes, very important because it stops some hormones that are called increte hormones. So when your increte hormones are not working, your stomach will not function well. So I was talking about Botox. Yes, it increte hormones when they slow, so everything slows in your stomach. It can make you have a gangrenous abdomen from inside. Because your stomach should be active and cells should be active so that you can be okay. Let's talk about Botox again. Reducing forehead wrinkles, forelines, these things, they block nerve signaling. And the first step when we have problems in the brain, what happens? The neurotransmitters are stopped. So why use up something? Miriam is here. Hi, Miriam. Miriam, we are talking about BBL, Ozempic, Botox. Here in Kenya, some people do BBL a lot. Why use something that can give you problems to gain what you have? Because you are benefiting from adverse effect, but it is giving you another bad effect. So I'm not for that. If some doctors are doing it, let them do the Botox. For me, I do the right thing. I do the right thing. See? So Life with Serena is here. I heard if you do it for diabetes, it helps, but lose weight is not. Let me tell Life with Serena. Semaglutide is an anti-hypoglycemic agent. What it does is, it makes you, if you are diabetic, to have normal body that has no high sugar levels. In this way, it stops absorption of glucose at the kidney and you urinate. So the glucose will not come back to blood. So that is stabilizing your blood. By doing that, if glucose is not absorbed, I had gestational diabetes and I took metformin and changed my diet. Yes, metformin is a good drug because it stimulates the insulin coming out. It stimulates the insulin to come out. You get? It's a good drug. Semaglutide is a medicine used. It is called GLP-1. So don't use things because of adverse effects. You are using semaglutide to cut because it is the adverse effects of people who have diabetes. And you have forgot people who have diabetes, they have high sugar levels. Clap for me. You get? I see those patches on YouTube and Instagram ads all the time. Very bad. I gave there is one day I gave I clap for myself again. I gave another example of a drug called cyproheptadine B. Cyproheptadine. Now, cyproheptadine is a drug that is used as an antihistamine. Have you ever used cyproheptadine? Anyone in the chat who has used cyproheptadine? Anyone who has ever used cyproheptadine? When you have urticaria, hay fever, itchiness, migraines, occasional serotonin syndrome in your brain, you can use it. When you are sneezing a lot, you can use it. But you know the side effects. The side effect of cyproheptadine, no, Benadryl, that one was, that drug you are saying, coffee cakes, it was banned in Kenya. I'll tell you why. There is Benadryl that has a codeine. People liked it so much because it makes a person high and relieves you and you sleep and you forget about your flu. But cyproheptadine is another one. Cyproheptadine. Sir, please tell me your income as a doctor in Kenya. You want me to tell you how much I earn per month? Like Sudafed. Yes, they have codeine. Now, cyproheptadine, the side effect of when it is an antihistamine and you have taken it or you have been given in a hospital, what it gives you is eating a lot. Here they make meth with it. Where? So they make meth with Benadryl because it has codeine. Codeine is a derivative of cocaine. Codeine, yes, you have to use ID now. Yes, you have to use ID. In Kenya, you cannot be given without a prescription from a doctor who is qualified. You You cannot. There are some things that are disturbing me here. I'm trying to take them away. You see? You cannot. So, when you take cyproheptadine, you eat a lot. It is the side effect. When you take antihistamine, what do? You feel eating a lot. The adverse effect. So when people are using something that is called semaglutide or Zempia, they cut weight. It is the adverse effect. But you know, when you are normal and you are using it, you are risking what? Having the thyroid tumor. You are risking having thyroid tumor. So why use something that can bring you problems to get to what you want? Just get a normal thing that will give you what you want. If you want to lose weight, go to your doctor, get good advice to a good doctor. You know, there are some wrong doctors that they'll give you anything. As much as you have money and they can get money, they'll give you anything. And do you think that is a good thing? Because before doctors are start to practice, they are given something that is called Hippocratic Oath. Someone is telling me in India that is legal. There is there are two types. One is called Benerin, which is diphenhydramine. But there is another one which has diphenhydramine plus codeine. That one is the one that you cannot buy over the counter. You have to have a doctor's prescription, and it is not just that one. We have several drugs that are having those. Helps with bad sinus cold infection. They no longer give us antibiotics for sinus. They feel good, that's through it. Better without. Yes, sometimes you can go to a doctor and sir, should I take benzodiazepine? No, you should not get in. You are a young child. And if you have not been diagnosed with a condition that you should use benzodiazepines, don't. There is one that children in high schools and colleges misuse a lot. I will not. It's a benzodiazepine. They like buying behind the curtains in the pharmacies, and they misuse it. So, coffee cakes, I was saying, when you go to a doctor and they are saying it's a flu that is viral, you will not be given antibiotics. And the one that you are given, maybe it's the Benadryl that has diphenhydramine alone. You use metformin. Oh, okay. If you are using metformin, how many grams, Miriam Mumbo, are you using? I advise you something. So there is that one that has diphenhydramine only, but there is that one that has diphenhydramine and the other one, which is codeine. So the one which is codeine, people are not given so much because it is addictive, and you see it has substance that is controlled. Sir, suggest me antidepressant pill. You are Jatin, how old are you? Before I tell you about 500 twice daily. Miriam, if you are using 500 milligrams twice daily, what I can advise you is work on your weight. If it is big, reduce weight. Stop eating a lot of carbohydrates. Use vitamins a lot, and one day you will stop taking those drugs. No, they say it is a sinus infection used to give antibiotics. Yes, if it is an infection, you need antibiotics if it's a bacterial infection. But if it is not a bacterial infection, you don't need antibiotics. You see, no, we were talking now they won't. Yes, we were talking about bipolar and we went away a bit because of some good questions from the people. So, before I continue, I've really talked a lot. Anyone who has a question, which vitamins? Miriam, vitamins from greens, normal greens, the ones you call kienyeji, and stop taking more of rice and ugali. So take little ugali and some protein, and forget about taking a lot of carbohydrates. If your weight is big, start working out, because exercise. Sha is sending love to everyone who is watching. Sha in the background, sending love to everyone. Lila, my friend, is here. When I see her, I start smiling because she is always jovial. Lila is always jovial. So, Miriam, start cutting weight slowly by slowly, and you will stop taking those drugs. Slow in carbohydrates. Take vegetables and vitamins of vegetables so that you feel good. Sometimes taking drugs is not a good thing. I feel that. If there is any way that your body can live without taking medication, that is the best way. If there is any way your body can live by just taking normal things like herbs, normal things like let's say normal things like foods, and then you feel good, why should we take drugs? Why should we take? Sir, please suggest to me. How, Jatin Choncha, how old are you? Tell me first before I suggest to you antidepressants. How old are you? If our bodies can live without taking drugs that are destroying our livers, 21, I will advise Jatin, at 21, instead of giving you antidepressants, please visit your college nurse or a psychiatrist, talk to her, or your parents, or even your lecturer. Talk to your lecturer about what you are undergoing. If it is a problem with with school fees, if it is problem with what you are doing, it is giving you more pressure, please talk to someone before getting into antidepressants. Antidepressants at a young age are not good, my friends. So Jatin plus the other friend that was here who was 20, the one who liked herbs, the one who liked herbs. Those ones are still children, and we don't want to expose our children to antidepressants. You see, Lila is telling Jatin, go for a walk to the park. Yes, but if it is a chronic thing, you can talk to your lecturer, your friends, or anyone. Stop thinking of antidepressants at a young age. Bipolar plus cardiovascular disease. You know, cardiovascular diseases are diseases like congenital heart diseases, hypertension, restrictive heart diseases, dilated cardiomyopathy, restrictive cardiomyopathies. Those are called cardiomyopathies. When you have these problems and you have bipolar, increases risk due to stress, poor diet, smoking, and medication effects. I have 36 hours shift at my academic. How do you study? In Kenya universities, they do units. And I see you are telling us you have 36 hours shift. Do you go to college on at work, or is your college your workplace where you go and work and learn, or you are working like a nurse? Oh, maybe you are a nurse, because nursing students, they are given 6 shifts, not like doctors. Yes, I understand. Maybe you are a nurse. Increased risk for cardiovascular complications due to stress, poor diet, smoking, and medication effects. So depression phase may reduce physically, worsening health and high mortality compared to general population. So people with bipolar complications, and they have cardiovascular diseases, they have a problem because it increases weight. Catecholamines with bipolar are more in your brain, and they bring other problems. You see, they bring other problems. You check that. I've really talked a lot, and people are not answering my questions. Imagine I've talked for, it's going up to 2 hours. We are going to 2 hours. Anyone who has a question, anyone feels everything that we have talked now, you need a question to be answered. Anyone who feels like I want to ask this question, or you want to add something, or you want to add something. Anyone? Ask me your question, Dr. Ben. Lila, I ask you a question. Do you still live with your parents, or you have moved out? Do you feel like living with your parents is like being in a small prison? Do you feel like when you are living alone, you will be still at your home? Lila, that is my question to you. Is it a question or multiple questions? Tell me if you feel. Tell me, Lila. Lila has told me to ask a question. So, people that are you're coming in, check if you have liked the chat. Check if you have liked the chat, my friends, and check if subscription is on. Check if my subscription is on, and ask me any question. Ask me any question. Lila, I'm waiting. You have told me to ask a question. Yesterday, I still laugh at yesterday. I told people, please ask me random questions. Where the kind of questions I really got the random questions that I was asking. The random questions that I was asking. Lila is saying, I moved out of my parents when I was 18. So yes, with your parents, it's like living in a prison. When people become 17, 18, 19, it becomes a problem living with the parents. Most of us men, when you go to university and you are away, Amy Akinyi, today you are here, Amy. Whoa, welcome to the chat, Amy Akinyi. How are you doing? Lila, where are you from? Someone is asking Lila where you are from. So when us boys, we go to university or institutions of higher learning, when you finish, you don't go home, you stay there. And people go to institutions of higher learning after high school, they are already 17, 16, or 18. That's why I've asked Lila that question. Now, not feeling well. Oh, Emi Akinyi, what's up? Flu? Or what is happening? You have a flu? Lila, Habs 5851. Lila have got another one like the other one that was here. The other one that was telling you to like. He was called Krishna. Lila has got another one like Krishna. Lila, are you a student? Someone is asking you that. A flu, 7 days it will be over. No worries. Today we were talking about bipolar and manifestation to others. So if you don't want your parents to keep telling you what to do, you better get a job and get your own house. Very true. Very true. Because with a job, they will not tell you stop working. You are already 17, 16 and you are working. And they will not tell you you have to. But there are some parents who will tell you stay in this house until we see you can live alone. There are some parents who do that. And sometimes I feel it's important because they are taking care of their child. Because at 18 and 17 years, you are still at risk. You are not mature yet to be, you get? You see, you are not there yet. So my guys who are getting in today, we were doing a bipolar associated with other symptoms, bipolar associated with other issues. So if you are coming in and if you are watching me for the first time, subscribe to the channel and like also, so, and give notifications so that you can be coming when the notification is on. You come and listen to what we are doing. This is a week of bipolar. Bipolar is something else. Even this my friend Lila, not Lila, my friend Jatin is asking me, this topic is so long, why is it not ending? It's not ending because it is a big topic and it is a mental health topic. So I want to finish it so that we don't go back there. If someone or some people will be coming and listening to it when it's not live. When it's not live. Jatin, nice, I'm a medical student. Jatin is a medical student. Okay. So, how many minutes to go? 13 minutes to go. Anyone who has any question for the 13 minutes, you can ask any medical question or any question that you think can help anyone. Because today we have really talked about bipolar. And I've talked about eating habits, bulimia nervosa, anorexia. Nervosa is recurrent binge eating. Compensatory behavior such as vomiting, laxative use, and excessive exercise and fasting. You see, your bipolar topic is very important. People are suffering from it and they don't know. Yes, they don't know. People are saying that, in bipolar, my sister Margaret from Norway, people say that those people they have bad character. They are not good to the society, and that person is suffering. When someone is telling you you have bad character and you are suffering medically, because these are medical problems, how would you feel? You are trying to explain to these people that you are sick, you need help, but they are not feeling it. They are not feeling it. So as we continue asking questions or thinking of any question that we can ask on the 10 minutes, or how many minutes are those on the 12 minutes that are remaining, extreme diet, food avoidance, excessive exercise, eating disorder symptoms of eating disorders that are associated with people that have bipolar are excessive exercise, weight loss, amenorrhea for ladies. You know what, ladies, do you know what amenorrhea is? Anyone who has knows amenorrhea, ladies? Let me not just talk things that I'm talking to ladies and I'm not explaining. Ladies, do you know what amenorrhea is? Amenorrhea, affects ladies, not men. If I hear a man here saying I have amenorrhea means the absence of menstruation period in female or reproductive age. You don't have menses, and you know when you have bad habits of eating, that can happen. Or when you are stressed, when you have depression, that can happen. When you have depression, weakness of the body. So ladies, now you know when someone has eating disorders like anorexia symptoms, bulimia, anorexia, you don't want to eat because you want to be slim and have a good, you will have amenorrhea. Your menses will get lost because of imbalance of hormones. You get weakness, cold extremities, hair loss, low blood pressure, and dehydration. Bulimia symptoms are like recurrent binge eating, self-inducing vomiting. Some people eat and then they want to vomit because they know they have overdone. What kind of friend are you looking for? Yes, Argentine, Toncha, please tell Lila what kind of friend you are looking for. Sore throat, electrolyte imbalance, swollen parotid nodes, guilty after eating, severe eating behaviors. You are eating, people say don't eat like a cow. You are eating like a cow. I go with you in a ceremony, in a wedding, and then people are noticing you are eating like a cow. Don't eat like a cow where I am. Stop eating like a cow. You see, it's called bulimia. Secretive eating behavior. Guilty after eating because you know you have eaten and you have made people look at you in a bad way. Someone who tell me about their culture and experience in abroad. Jatin is saying he just need a normal friend. Jatin has told me yesterday he has a girlfriend. Jatin has a girlfriend. So he needs a normal friend to interact, to know about your culture, how you live in the US, how you live in Africa. Jatin wants to explore with friendship. See, so guys, cure for bipolar according to me, enjoy life and take it easy. But now you see it's a genetic thing. Lila, you find yourself that you are bipolar and sometimes you get an episode. You cannot avoid the episodes. You cannot avoid the symptoms. You get yourself into it. There are some things that are called binge eating symptoms. So how do you know that you are a binge eater? You eat a lot. I'm waiting for anyone to ask to ask a question or add, like the one Lila is saying. Cure for bipolar to me. Enjoy life and take it easy. Enjoy life and take it easy. You get? It's very important to enjoy life and taking it easy. So my friends, when you are having these problems, it is very important you find that you are bipolar and you are eating a lot and you are gaining weight. You have noticed people that have problems when it comes to the brain and psychological issues, they are always gaining weight because of the drugs and the events that they are undergoing. Don't go to Ozempia. Don't go to take Ozempia, my friends. What you need to do is to talk to a doctor to help you. Tell the doctor that since I started taking this medication, since I started taking these medications, I am having problems with, wait a minute, I am having problems with, sorry that I was pinning something somewhere. I am having problems with weight. I'm gaining weight because of this medication. So, what will happen? The doctor will give you an advice on how to do what? On how to go about everything. So that is it, my friends. I think my time is about, I have 5 minutes. I have 5 minutes to go, and I thank everyone who always comes in and watch me. Today I received so many. I was about or something. Someone is saying I was about to pin it. So thanks so much for your concern. At least you feel that someone. My sister texted me, "You are not having a life. What is happening? What is happening?" You see, but sometimes work issues. Sometimes you find yourself working. You find yourself in a condition you are so. For me personally, I find myself at times between so many things. I find myself between so many issues. So everyone who is here, everyone who has been here, I have 3 minutes to go. My time is about to go now, and if anyone with a question, or I give yes, and time moves quickly. Yes, time moves so quickly. Sometimes when you have not found me at 4, always I usually come at, here it is at night right now, it is 10 or 6 p.m. So thanks for sharing. I see some people are sharing. YouTube gives you the sharing, the how many people have shared. So thanks for sharing, always giving me motivation to continue talking and talking. 1 p.m. 1 p.m. That is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wow, those are 9 hours. Imagine 9 hours. 9 hours from 1. We are ahead of you, Coffee Cakes, by 9 hours. Imagine. Jatin Choncha, nice meeting you. I'm 4 years older than you. Take care of yourself, please. Yes, take care of yourself. 11 a.m. Yeah. Oh, okay. See how time is. Ben, I have notification on your live stream, but I didn't get. That's why I asked you. I a reminder will be online as is. I woke up today at 4. I was so busy from that time, and I forgot to put even. Sometimes lives I don't put notifications. I just come online and start talking, and we continue with the topic of the day, like the one we have done today. So that is the people who have been watching. You see how we interact here, and we bond. So the session today has been 2 hours. Imagine talking for 2 hours, explaining, thinking, interacting, laughing. Some people coming to the chat, they make you laugh. It's a good thing. YouTube is a good experience. Sometimes it is a stress reliever. YouTube at times it's a stress relief. Sir, please tell me your income in Kenya as a doctor. I will not tell you my income in Kenya because I work privately, I work in hospitals for the government, so how will I tell you my income? Maybe you ask about income in India, my friend. So, bye guys, bye bye, see you tomorrow. I'm really worked out today, working from 4. Imagine. Let me just say, be blessed, everyone who has watched. Continue sharing, and let's continue being friends. Bye, Ben. See you tomorrow. Thanks a lot. Bye.